Hi everyone, this is Dr. Bharadwaz. I am a homeopathic doctor from Fidicus Homeopathy. Topic for the day is osteoarthritis. We will look into it. We will look into the reasons why osteoarthritis occurs and what is the conventional treatment, what is the homeopathic treatment, how homeopathic treatment is the best compared to other treatments. Okay, osteoarthritis is a disease where the cartilage of the bone is degenerated depending on the age. So it is a geriatric disease. It means after 40 we develop that kind of a disease, and it occurs in both the sexes, males and females. It occurs equally. And also the site, this majorly occurs on the weight bearing joints where we put weight on the joints. For example, we put weight on the hip joint, knee joint, ankle joint, and also elbows, shoulders. It also occurs in the small joints as well. So what are the clinical features? The number one clinical features is the patient feels pain. There will be stiffness, there will be deformity of the bone, deformity near the joint. You can observe swelling, limping. Patient, when it occurs on the hip joint, ankle joint, or knee joint, patient limps sometimes, and also the joint give away. These are the symptoms complained by the patient. And what are the signs? So there will be swelling, there will be deformity. When you touch, the joints are tender, and when you examine, the movements of the joint is restricted. These are the clinical observations by the doctor. What are the investigations for this? Normally in early stages, or 99%, it will be diagnosed with the symptomatology and also a simple x-ray. In some cases it may require CT scan. So see the anatomy of the joint. This is the joint, this is the healthy joint. You can see all the parts of the joint, cartilage, ligaments, tendons, capsule, everything is intact. And in future we are going to see what are all the damage that are going to occur for this joint. The function of the joint is to create the movement. What are all the causes? So there are two types of osteoarthritis: primary osteoarthritis and secondary osteoarthritis. The primary osteoarthritis is a systemic disease where when a disease occurs throughout the body, we develop cartilage damage. That is primary osteoarthritis. There may be genetic causes, there will be metabolic causes. Age is also a factor. Idiopathic avascular necrosis is one of the diseases that causes osteoarthritis. There may be endocrine factors and obesity. These are all the primary causes. Secondary causes or secondary osteoarthritis is due to the local changes. If there is any problem within the local within that joint or near the structures of that joint, we are going to land into secondary osteoarthritis. Okay, what are the factors? There may be damage, trauma, incongruity of the joints, malalignment, inadequate blood supply to that particular joint, inflammatory diseases, any inflammatory disease near the joint, and it may be also nutritional deficiencies. What is the pathology? You can see the cartilage is damaged. Along with the cartilage, synovial membrane, adjacent tendons, bones, and capsule is also joint in damaged in severe causes. So in the next slide, you can see the left side is the healthy joint, and on the right side we have the damaged joint. You can see synovial membrane is damaged, cartilage is damaged, capsule is damaged, and sometimes bone is also involved in very severe cases. What is the conventional treatment? Conventional treatment is painkillers or surgery. In conventional treatment, you have to suffice it with painkillers, or you have to go with the surgery. So these painkillers will have a lot of complications. They may be addictive, they may be damaging other parts of the body. And next we will see how homeopathy can manage this. So homeopathy attacks this particular disease in different ways. The first one is constitutional. So constitutional in the sense, every human being has a physical stress. For example, you are living in an environment where you don't like, for example, you like cold weather, but the weather is hot. That causes a stress. This in turn produces chemical changes in the body that may lead to osteoarthritis changes. Physiological changes. Each person's metabolism will be different in different conditions. So by considering all these physical changes, physical stress, physiological stress, and mental stress, we give the treatment to the patient. So we will correct the damage done by this stress. That is a constitutional treatment. Apart from constitutional treatment, we also give local treatment. This is disease specific. We have specific drugs to regenerate the bone, to some extent regenerate the cartilage, to reduce the pain, to reduce the swelling. All these local changes we will also be treating with specific drugs for these changes. We try to prevent the further damage of the joint. Or for example, if you are going to stage 1 to stage 2 in 10 years, so we can prolong it to 20 years or 30 years. So we can prevent the further damage of the joints or further progress of the disease. Once the disease is there, we can cure it. Mostly we try to cure, and also when the cure is not possible, we will give the relief, cure and prevention without any side effects. And you can use this homeopathy treatment as an adjuvant therapy as well. For example, you are already getting treated with a allopathic doctor, happy with the painkillers and whatever the treatment is there, or after the surgery you are okay with the painkillers. You can parallelly use homeopathic medicines so that it will decrease the damage caused by other things, and also it will increase the effect of the medicines, and also you will have the cumulative effect. So the effect of that original drug and the effect of homeopathic drug, you have a cumulative effect, and also you will have additional effect. So if you are already on the allopathic treatment, what we can do is we can simultaneously start the homeopathic treatment as well. Once the symptoms get decreasing, or we can slowly decrease the conventional treatment, finally we can sometime bring it to only homeopathic drugs. With this I conclude this: we cannot succeed in every case, but with us you have the best chance of success for this osteoarthritis. You can directly contact us on our mobile. There are two kinds of consultation available. You can consult online and medicine is shipped to your doorsteps, or else you can come to us in person and get treated. Thank you.